I'm Dr. Lauren Streicher, a gynecologist, a professor, and a sexual medicine and menopause expert. I'm betting that your doctor has never asked about your ability to have an orgasm. And for those women that do get up the nerve to tell their doctor that something has changed and having an orgasm is either difficult, impossible, or takes so long that it's not worth the effort, he or she often has nothing more to offer than, "I'm sorry to hear that." As you get older, aging and sometimes vascular changes from diabetes or heart disease can make your clitoris less responsive than when you were in your 20s or 30s. So I'm going to fill you in on 5 tips that may kick your clitoris back into action. Tip number 1, estrogen is not required to have an orgasm. And that's great news if you're postmenopause and not taking hormone therapy. But while estrogen is not required, it is helpful and will increase blood flow to the clitoris. So here's my tip. If you're using a local vaginal estrogen cream to help with vaginal lubrication, take a dab of that cream and apply it directly to your clitoris at least twice a week. If you're not using an estrogen cream, this does require a prescription, so you will need to take a trip to your doctor. Tip number 2, while we are on the topic of increasing blood flow, another approach is to apply a dab of CBD oil to your clitoris around 30 minutes prior to sexual activity. Rub it in slowly, really slowly. CBD is a known vasodilator, which means the teeny little capillaries that are required to keep your clitoral nerve endings healthy will get more blood flow. Now, this has not been scientifically tested other than in bedrooms around America, but the science of the cannabinoids supports that it should help, and it won't hurt. Tip number 3, pain is hardly an aphrodisiac. It is virtually impossible to become aroused if you are either anticipating or experiencing pain. And it has been scientifically shown that it is practically hopeless to have an orgasm if you're not aroused. More important, pain is never okay. Never. Get rid of the pain, and you will be far more likely to not only anticipate and enjoy sex, but to become aroused enough to orgasm. Tip number 4. Your antidepressant may be part of the problem. Up to 30% of women who use an SSRI have difficulty with orgasm. Sometimes this is temporary, but sometimes it's not. So you need to work with whoever prescribed the antidepressant to see if maybe a smaller dose is just as effective, or maybe see if it's appropriate to switch to a different antidepressant. Sildenafil, which is commonly known as Viagra and Cialis, is only FDA approved for use in men, but it has been shown in scientific studies to help women who are unable to orgasm because of their SSRIs. And I know it's tempting to just grab his little blue pills, but this is not a do-it-yourself project. If your antidepressant is the culprit, you really need to work with an expert who can advise you what to do. And finally, tip number 5, nerve endings that are less sensitive need more stimulation. So if the only thing that vibrates is your cell phone, it's time to go shopping. Clitoral stimulation with a bullet type vibrator is a game changer and can be used on your own or with a partner. There are even vibrators that are specifically designed to be used with partnered sex. I'm Dr. Lauren Streicher. For more information, check out my inside information books on menopause, including Slip Sliding Away, Turning Back the Clock on Your Vagina, and Hot Flash Hell, a gynecologist guide to turning down the heat. My podcast, the Menopause Podcast, is not only a great way to get information on the go, but you will hear from some amazing guests. So follow me on social media and arm yourself with information.